Good morning, everyone, and thank you for coming out to our local office of the Alzheimer Society of BC. My name is Jim Mann, and I have Alzheimer's. I was diagnosed in early 2007, so what I am doing today is personal to me, to my wife Alice, and for our greater community. I am honored to stand before you today as I begin a 7-month campaign that we are calling Jim's Push for a Plan, an Alzheimer's plan for BC. Today is our first step. As I begin my travels around the province, I want to meet people like you, like me, in many of the communities where the Society has offices and where staff works directly with people with dementia, their families, and their caregivers. In communities where people with the dementia and their families live and work hard to maintain a sense of normalness in their lives for as long as they can. Along the way, I hope to talk to sitting MLAs, to candidates from all parties in the provincial election scheduled for May 14th, 2013. I want to talk to neighbors, friends, families, and especially those, like me, living with Alzheimer's or other dementias. To mayors, councillors, business and community leaders. But that's down the road. Today, the conversation begins here, among us in this room, where I am pushing for a plan and pushing real hard. A plan to ensure that our province is not only getting ready, but is ready to meet the needs of the 70,000 plus people today who are living with a dementia in our province and their families. You know, businesses don't just happen to make products. They plan to make them and forecast how many will be needed. Families too plan. They plan a budget. They plan a trip. Likewise, BC needs a plan to ensure that our province, our government, our hospitals, the staff at the hospitals and in long-term residential care homes, for example, is ready to support and provide care for the increasing numbers of people with Alzheimer's or other dementias. Let me be clear. What I mean by a plan is more than just meetings, more than promises, more than just empty words on pieces of paper, and more than side projects. What we need is to face the reality head on. We need real change, and the best and really only real way to achieve that is with a comprehensive plan to get us there. So, yes, I am pushing for a document that clearly identifies the way forward, a comprehensive and detailed plan, a plan that is funded and with benchmarks to mark our progress. The plan I want to see will first of all acknowledge the many issues facing us as people with a dementia, along with our caregivers, and then provide a roadmap for this journey of ours. The plan should promote early diagnosis so families can organize their affairs and maybe even investigate drug trials. The earlier their diagnosis, the earlier they can adapt and learn there is indeed life after diagnosis. It will ensure there is access to support so family caregivers are able to sustain their caring. The plan I envisage includes healthcare providers getting the education they need to provide the best care possible, both in the home and in a residential care setting. It will virtually guarantee that everyone in our province facing a diagnosis of dementia, along with their families and caregivers, are connected to the Alzheimer's Society of BC as soon as possible after diagnosis under the auspices of the First Link program. And here's the reason we need this plan. Every year, 15,000 more people develop dementia. That is just the individual. In the majority of cases, each person diagnosed has 2 or 3 other close friends or relatives whose lives are also affected by the diagnosis. Those are hard numbers to hear, aren't they? There is no known cure for Alzheimer's, and there is no known cause for Alzheimer's, and there is no cure yet. But along this trajectory, by 2038, it is estimated that there will then be over 35,000 new people, and I emphasize the word new, who annually develop dementia. Can you believe that number? The associated cost to BC will reach a crisis point, not down the road or some far-off point in the distant future, but during the mandate of the next government. Healthcare costs are already skyrocketing. We read about this in the newspapers, don't we? And some of the numbers are very scary. But with a comprehensive and detailed plan, we have a chance to change, and I dare say improve the future for individuals, for healthcare providers, and for our provincial economy. We need to take action now. Please join me in pushing for a plan. Dementia must be a healthcare priority in BC. And you can learn more by going to the Alzheimer's Society of BC website at www.alzheimerbc.org. So please tell your friends and neighbors about Jim's push for a plan. Write letters to the editor of your local paper. Meet with your current MLA as well as any or all candidates for election in your community. In 2010, when the Alzheimer's Society released its groundbreaking report, Rising Tide, I said then, and I quote, "Alzheimer's disease and other dementias are a tragic reality for a rapidly growing number of families. The time to act is now. We need a plan in BC," end quote. I've been waiting, and I still don't see the plan that meets the criteria or characteristics that I have just spoken about and that I think are needed. So in these past 2 years, we have lost precious time. And that's time I don't have. I have a window of opportunity on this journey to help change the course of the rising tide. So please, support my campaign and help me in my quest for a plan to meet BC's Alzheimer's crisis. Join me in my push for a plan. Thank you.